Hello everyone and welcome. Let me ask you a question. Have you ever opened your lab report and just stared at the page? What are these numbers, abbreviations, and red highlights? Most people have. It's a universal experience. You're not alone if you felt overwhelmed or confused by lab reports. Today, I want to make this relatable and clear. We'll break it down step by step. The first reaction to lab result is often shock. You see strange terms like A1C, ALT, TSH, CBC, LDL, HDL, and lots of numbers as a range next to them. You might even try to Google it and only end up more confused and scared. Now let's talk about the biggest source of confusion, the concept of normal ranges. Most lab reports show whether your results are in a range, in normal range, or out of range. But here's the truth. Normal range doesn't always mean you're healthy, and being slightly outside the normal range doesn't always mean you have a problem. These ranges are based on an average of a large population and not necessarily means the ideal things for you. These ranges are for a specific age and gender, but it doesn't consider your health condition. It doesn't consider your uh, past medical history, your drug history. And even sometimes it doesn't consider the exact range for your age, especially for infants, toddlers, younger individuals. You are different. That's why your personal baseline and also history matters. When we are going to interpret one lab results, we should put all information together, also combine with patient's history, physical exam, past medical history, and other tests, and then tell the patients what's the problem. It's not just about the normal range. Maybe sometimes a parameter is within normal range, but this is not normal for a patient, or this is outside the normal range, but this is okay for this special patients. It should be seen as a whole, not just one number. There's also a difference between what is considered as normal and what is considered as optimal. Normal range often means you're not in immediate danger, but optimal level are where your body function best in long term. For example, someone cholesterol might be in normal range, but this not necessary at the optimal level to prevent future cardiovascular disease. Thinking in terms of optimal, not just normal, can help you aim to better health outcomes. Now we understand the basics. So what should we do with our lab results? First of all, please do not Google your lab results. For example, ALT and AST are markers for liver function. When they are slightly higher than normal, it just can be due to some non-specific things or a little fatty liver. But when you search for high AST, ALT level in the internet, it will give you lots of very serious conditions, from hepatitis, autoimmune disorders, cancers, and many things. You will be completely anxious due to nothing. The second one, please focus on trends. For example, your blood glucose or blood cholesterol level have a trend. You should keep in your mind that you should compare yourself with yourself. Compared to the previous one, if you are going to have you are having higher number, even if it's in the normal range, maybe there's a problem, and vice versa. It means that your trend of results are very important. And the third one, please always consult with your doctor, because as I mentioned before, when we are going to make a diagnosis, we will merge all information together, not just numbers. Sometimes we should add some more tests to jump to a conclusion, or sometimes we need a detailed medical history, sometimes we need imaging studies, sometimes we need lots of other things, and sometimes with the first glance we will understand that there is no matter, it's not important. Many times there's lots of flags in the lab results, something is high or low, but that special thing does not matter at all, it's not important. That's why always consult with your doctor. Now let's talk a little about common lab tests. I explained most of them in my previous videos in details, but just now for a quick review. One of them is a comprehensive metabolic panel, CMP. It just measures kidney function with BUN and creatine, CR, liver function with ALT and AST, sometimes ALP, alkaline phosphatase, and sometimes bilirubin, blood glucose as fasting blood sugar or random blood sugar, or sometimes hemoglobin A1C. That means that what was the average of your blood sugar in the last 3 months. With these tests, we can have a whole view of your organs and functions and whether there is any imbalance or not. The other very important test is CBC, complete blood count. This is very important and test with lots of information. We can see lots of information about your red blood cells, white blood cells, platelets. We can understand if there is anemia or not, there is infection or not, there is some kind of bleeding disorder or not, there is some kind of cancers or not, there is some kind of parasite like malaria or not, and many different information. Please never Google anything about CBC, because for each parameters, the differential diagnoses are very wide. It should just be interpreted based on the patient's history, clinical exam, and all the things, other things, not just as a number. The other one is a lipid profile. A lipid profile includes total cholesterol, HDL or good cholesterol that protect your heart, LDL or bad cholesterol that is a risk factor for cardiovascular disease, and triglycerides that also is an independent risk factor for cardiovascular disease. All these values together will help us understand the overall risk of your heart disease. The other one is thyroid test. Thyroid test is very important. The first doctor will ask for a TSH, and this test is so sensitive. You should be for this test, you should just do this test in the same time each day. If you are going to repeat the test in the same time in the morning, in the day, and it's better to be in the morning. And before that, you shouldn't have stress and things like that. If it's high and low, we can understand that if there are hypothyroidism or hyperthyroidism. Trend is very important. Sometimes patient is hypothyroidism, has hypothyroidism and is under treatment, and sometimes that treatment is more than enough and can lead to hyperthyroidism. Based on the result trend, we can understand that what's going on, not just the number. trend is very important for TSH2. Again, please resist this temptation to Google your results. As I explained completely, when you are Google a special test, like anything like FPS or ALT, the Google does not know anything about your history, your presentation, other problems, drug history, and it will gives you a long list of benign and malignant and dangerous and not dangerous things, and you will get anxious for nothing. Do not Google your result, not just lab result. Do not Google any medical conditions, because this is not you. They will give you all information about this special, for example, sign. That is not you, and you will be so scared until you can visit a doctor. I know it's very hard to not Google something that you don't know, you cannot understand, but just do that for yourself, because it will be so scary for you, because it's not just you, it's all the patients with this single problem in the whole picture, but different pictures, single problem. That is not the same. This problem is interpret differently in different scenarios. That's why never Google your result. Always talk to your doctor. Doctors will see all together your signs, symptoms, past medical history, past drug history, family history, and also sometimes more tests, sometimes imaging tests, sometimes um, just a follow-up, sometimes just a small change in the lifestyle. That's why always doctors should read that lab results for you, not yourself. Thank you so much for joining me today. Always remember, your health story is far more than just some numbers on a page. It's about context, trends, and how you can use this information to live healthier. Stay curious, stay proactive, and I'll see you in the next session. Thank you.